This is part 2 of this interesting case presentation titled Potential Reflex Relationship, Ankle or Talus Restriction, Hip Restriction, and Bilateral Sacroiliac and Pelvic Motion Restriction. The question is the sacroiliac or pelvic restriction treatable? And I know that a lot of paradigms would say, oh, your sacroiliac joint needs to be mobilized or adjusted or something like that. And in this kind of presentation, based on experience, I would say that that simply would not work in altering his pelvic posture. I just finished treating him. I think we filmed less than 5 minutes ago, something close to that, and I brought this talus forward. He now has normative mobility, normative passive accessory motion, springing the tibia. The talus also can be loaded and then a passive force imparted. His passive range of motion is now equal, and when we test his subtalar motion, it's significantly improved. And I can evert and invert the calcaneus there, and it feels very similar to this side. So let's have you lie on your stomach. The other thing I worked on was hip extension, although he felt very strongly that it had already been normalized before I treated it. But here it is. Observe that when I flex the knee now, you don't see that significant pelvic rotation here. Okay? Prior to that, coming up just about 45 degrees, this pelvis significantly rotated in the transverse plane. That no longer happens. Okay? And I'm going to come over here so I don't block the view. So he has gained certainly a little more than 15 degrees. I suspect we'll work on this side to gain a little bit, because now the right feels tight. I'm sure I can get it a little bit higher than that, but this now feels tight relative to this. But I want to forge ahead and just see what the pelvis does. So since we tested you previously with you on your back initially, would you lie on your back, please? So here's the big test, the question being, can we enhance mobility through his pelvis by treating hip and ankle on the left side? And I don't know the answer. Take it the slack, it distinctly moves. Okay? From here, from the left to the right, it moves. Inferiorly, I can see his feet bob up and down. Can you capture the feet, please? I can load the pelvis, and you can see that force goes through the pelvis into the hip, knee, ankle, and when I spring it, you know, the foot bobs up and down, and then I let go. Lie on your stomach, please. Here's a sacral spring. I can see both heels move, so the movement goes through the hips and down into the lower extremity. I can take it the slack, and I can spring it. Distinct movement going through that structure. I can take it the slack superiorly and spring it. Distinct motion. Would you lie on your back, please? So he's been using a heel lift of 4 millimeters for a very long time. And he did look like he had a leg length inequality, but he no longer does. Sorry about the dogs in the background.